Welcome to today's exploration of fibromuscular dysplasia, or FMD. This condition primarily affects arteries, and we'll be focusing on its impact on the urinary system, specifically the renal arteries. Join us as we delve into the causes, symptoms, diagnosis, treatment, and more to gain a comprehensive understanding of this complex disease. The exact cause of fibromuscular dysplasia remains unknown, making it a challenging condition to understand. Researchers believe it's likely a combination of genetic predisposition, hormonal influences, and environmental factors that contribute to its development. While there's no single, definitive cause, ongoing research aims to unravel the mysteries behind FMD's origins. Fibromuscular dysplasia is characterized by abnormal cell growth in the walls of the arteries. This growth causes the artery to narrow, weaken, and sometimes even bulge, forming an aneurysm. In the renal arteries, these abnormalities restrict blood flow to the kidneys. This reduced blood flow can trigger the kidneys to release hormones that elevate blood pressure, leading to hypertension. Over time, the compromised blood supply can also impair kidney function. Fibromuscular dysplasia is considered relatively rare, although its true prevalence is difficult to determine as many individuals may be asymptomatic. It's more common in women than men, typically affecting those between the ages of 30 and 50. While FMD can affect individuals of all ethnicities, further research is needed to understand any potential disparities in prevalence. The signs and symptoms of fibromuscular dysplasia affecting the renal arteries can vary. High blood pressure, often difficult to control with medication, is a common indicator. Individuals may also experience flank pain, a dull or sharp ache in the side or back, indicating reduced blood flow to the kidneys. In some cases, a brute, an unusual sound heard with a stethoscope over the arteries, may be present. It's important to note that some people with FMD may experience no symptoms at all. Diagnosing fibromuscular dysplasia typically involves a combination of imaging techniques. A renal artery ultrasound with Doppler can assess blood flow to the kidneys. A computed tomography angiogram (CTA) or magnetic resonance angiogram (A) provides detailed images of the renal arteries, revealing the characteristic string of beads appearance caused by the alternating areas of narrowing and widening. A renal angiogram, an invasive procedure using a catheter and contrast dye, offers the most detailed visualization of the arteries, but is usually reserved for cases where less invasive tests are inconclusive or when intervention is planned. While there aren't strict classifications or types of MD, it's important to note that the disease can affect different arteries in the body. When discussing renal FMD, the primary distinction lies in the location and severity of the arterial involvement. Some individuals may have FMD affecting only one renal artery, while others may have it in both. The severity of the narrowing or aneurysm formation also varies, influencing the choice of treatment. Treatment and management of fibromuscular dysplasia aim to control blood pressure, improve blood flow to the kidneys, and prevent complications. Medications like ACE inhibitors or ARBs are commonly prescribed to lower blood pressure. In some cases, angioplasty, a minimally invasive procedure to widen the narrowed artery using a balloon catheter, may be necessary. For aneurysms, surgical repair or stenting may be considered. Regular monitoring of blood pressure and kidney function is crucial for managing the condition long-term. Currently, there are no known ways to prevent fibromuscular dysplasia due to its unknown etiology. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can contribute to overall cardiovascular health. If there is a family history of FMD, discussing this with your doctor is essential for appropriate monitoring and risk assessment. The prognosis for individuals with fibromuscular dysplasia affecting the renal arteries is generally good, especially with early diagnosis and appropriate management. Controlling blood pressure is crucial to prevent long-term kidney damage and cardiovascular complications. Recent research focuses on identifying genetic markers associated with FMD, which could lead to better risk assessment and personalized treatment strategies. Scientists are also exploring new imaging techniques for earlier detection and less invasive interventions for improved outcomes.